Good morning. My name is Dr. Melody Medley Keith. We are here in beautiful Lakeway, Texas, and we have these little Snapinars every other week, twice a month. And if you're interested in them, it would be awesome if you gave us a thumbs up or hit that like button, subscribe to us, and then you will get notifications when we do these, which would be great. So today, what we're talking about is sleep. Sleep deprivation. Oh, it is a huge problem here. Estimates are 60% of Americans at one time or another have difficulty sleeping. And if that's you, that's probably why you're watching this, or you have a loved one that has difficulty sleeping. So what I'm here to talk to you about is some things that you can do to help with your sleep, right? Okay, so as we get into it, and I know you're sitting there going, well, she's a physical therapist. How can she help with sleep? Well, there's a lot of things physical therapists do, and one of them is to help with how we can get in and teach you breathing, teach you exercises, teach you things that you can do to help with getting to sleep and staying to sleep. And a lot of people think that sleep is just something that you should just do. You should just, everybody does. But a lot of people go, well, I can't get to sleep, or I'm in too much pain to go to sleep, or I can't breathe when I go to sleep. I just don't feel well, so I don't get a lot of sleep. We know that the health implications for lack of sleep are huge. They lead into diabetes, hypertension, heart issues. They also lead into just to where that you are not attentive. There's more people that have sleep deprivation, have more motor vehicle accidents. And again, it is one of the signs of early death. Not sleeping. So it's a big issue. So what I'm going to do is we're going to go through some things that may help you, just some ideas, right? And if you need any other information about sleep, then I'm going to recommend that you see a behavioral psychologist who is, their specialty is sleep. And they do not just sleep studies, not just to go in and get like a CPAP or, something that's going to help you breathe. Because there's lots of different types of sleep issues out there. And we are not going to just hit on one or two. I'm going to try to just give you an overview of what you can do for sleep. Right? So again, sleep troubles. Our first plan is plan to sleep. Experts tell us that you should be planning your day the night before and plan how many hours you want to sleep. At least 7 hours. Now, some of you are going to say, well, I feel better when I get 8.5. I really feel better when I get 6. But again, experts say, and all of the sleep people say, that a minimum of 7 hours. And when you start to plan your day, instead of going, well, tomorrow I've got to pick up the laundry, I've got to do this, you really need to plan how long you need to get to sleep, right? And how long you're going to sleep and then when you're going to wake up. Because planning your sleep is a part of your day so that you know when you're going to go to bed and when you're going to wake up. So you stay in that plan of when you're going to sleep, when you're going to wake up, right? So plan for your sleep. Make sure that when you're planning your day, you're also planning your sleep. My next tip, mindful environment. So again, in your bedroom, what the experts are saying is you should only sleep and have sex. That's it. No reading, no playing Sudoku, none of that stuff, right? There's only 2 things that you should be doing in your bedroom. And you need to be mindful of your environment, right? Make sure it should be a dark, cool, safe, and very, very quiet environment. And I know there's people that say, well, I like to have a little, soft white noise or, something in the background, waves. That's all fine. But it should be dark. It should be quiet. It should be safe. And it should be cool, a cooler environment. And when you go to bed, then you have planned your sleep. You say, well, wait, it's going to take me a little bit to take my makeup off, brush my teeth, and get ready for bed before I go to bed. So the other tip I can give you for sleep is now the evidence is saying light therapy is very important. And what they're recommending is that upon arousal, get up, go do your stuff, get going. But they're suggesting that you go out and look at the sun. The best thing for us as physical therapists is we would like for you to get up and go for a 20-minute walk out in the sun. Now, I get it. Sometimes it's not sunny, but you need to open up your curtains in your bedroom, look through the light, and that helps with your body kind of getting into the rhythm, getting into the plan of sleep. So light therapy. And then the last tip that we're going to give you is now all of the experts are saying that 20 to 30 minutes of mindful stretching and breathing really help you sleep better. So this would be on top of all your other routine. You're going to get in and you're going to do some stretching and breathing. And you guys know Amy, she's a PTA here at Lakeway Aquatic Physical Therapy. We're going to show you some mindful stretching that you can do. I love the balls. It's something very easy anybody can have, right? And again, you're not doing it in your bedroom. You're doing it in your living room or something, right? Yeah, that's it. She's like, yeah. So we're just going to sit on the ball. Again, remember this is not strenuous. This is just something to get in and move. And the reason we like the movements, the pelvic movements, and you'll see she's going forward and back, side to side, and circles. And Amy will be demonstrating that. The reason we do that is what that does is calms the sympathetic parasympathetic nervous system down. So it actually will relax you. Then while you're doing this, you're just doing some deep breathings. You can do yoga breathings for those of you that love yoga. That's that inhale for 4, exhale for 4, inhale for 5, exhale for 5, inhale for 6, exhale for 6. So reminding that you are getting ready to sleep and calm the body down. So breathing is a very, very good way, right? So also, if you just like taking breaths in, you can take breaths in just from your nose and just take some quick breaths in and out and just keep trying to breathe deeper. Okay? The next one we're going to show you is just kind of a nice little side stretch. So you're just going to come in on the ball and just kind of stretch up to the side. And reaching up and breathing, do your breathing, stretch to the other side, right? Yep. And then the last one that we're going to do is just stretching out the legs. And we just do a nice little straddle stretch. And we just kind of come in. You can go to one side and then the other. We kind of almost like a side lunge. And you're just kind of moving nice, slow, and mindful. Just stretching and breathing and just coming back to center a little bit and breathing and going back and breathing. Again, as always, I always recommend that you do 10 of these, but they're slow and mindful, right? So for those of you that would like more information about trying to get to sleep, right? Again, there are behavioral psychologists that are out there that you can Google. The great thing is that they do a lot of this by telehealth, where you can just go online and talk to them. And for those of you that want to have somebody, a therapist, such as ourselves, to come in and just review over some ball exercises or review over some other exercise. Maybe you don't have a ball, then just give us a call. We can also do it per telehealth and just go in. That way I can kind of see your environment. I see where you're at and see what's going on. Now, for those of you that do already have a CPAP machine and you do already have some sleep issues that you know of, then it might be good to go back and have them checked. Have your CPAP machine checked. Have everything checked and make sure that you're doing the things that keep that machine working properly, right? And then adding some other things that are going to help you get to sleep, stay to sleep, and get the rest you need to be healthy. Healthy sleep is really when the body heals. So for those of you that are in pain, that's where a lot of my patients are in pain and they're not getting the sleep they need. That's where we're like trying to get them to stretch a little bit before they sleep. Also, using ice. So there's things that you can do that we as physical therapists can help with. So if you have any other questions, any other things that you would like to talk about, please give us a call here at Lakeway Aquatic Physical Therapy. We'd love to hear from you. If there's any ideas that you want us to talk about in the future, you can always give us that information. Okay? I want you to have a very good day and go plan your sleep. All right. Bye, guys. We'll see you next time.